Keeping someone safe doesn't always mean keeping them still. Sometimes it means giving them space to move, familiar comforts, and a care team that truly listens. Hello and welcome. My name is Dr. Miriam Thake, and I'm a geriatrician at the Ottawa Hospital.
And I'm Natasha Patel. I'm a physiotherapist at the Ottawa Hospital. At the Ottawa Hospital, your safety, comfort, and dignity are our top priorities. Today, we'll talk about mechanical restraints in older adults, what they are, how we try to avoid them, and clear up common myths you might have heard. Mechanical restraints are devices used to limit movement, like belts or wrist holders. We use these restraints very carefully and only if other safer options haven't worked. Our goal is always to support older adults' independence and well-being first.
Research tells us that older people are at higher risk of restraint use compared to younger people when in hospital, even though their use is not recommended. At the Ottawa Hospital, we know that this risk is even higher for older adults who are living with dementia or who have a delirium in hospital. Sometimes when you're in the hospital, changes in your health, medication, or surroundings can make you feel confused or restless. This can lead to changes in behaviour that increase the risk of harm to yourself or others. Because of the natural changes and other health conditions that may come with ageing, older adults benefit from care that is tailored to their unique needs. The care for older adults includes identifying risk factors for becoming confused, noticing changes in behaviour and recognising any new confusion early on, and adjusting the care based on that. Now let's clear up some common myths around mechanical restraints. Some people believe that restraints help prevent falling or keep everyone safer. But in reality, sometimes they can cause physical harm and emotional distress for both patients and staff. They often make people more confused or agitated, not calmer. There's also a myth that restraints are standard for older adults or that they reduce staff workload. The truth? Ontario law says they must be used as a last resort. That means that we must try all other options to keep you safe and can only use restraints when nothing else works. Restraints actually require more staff attention, not less. Some think there aren't many other things we can do, but there are, like pain management, personalised care, and calm and consistent support. And finally, yes, consent is needed. This means that you need to agree to having a restraint. Only in an emergency, restraints can be used without informed consent. And when they are used, it's for the shortest amount of time, with ongoing review and communication. Even short-term use of restraints can cause trauma, fear, and physical harm, especially in frail older adults. So we must work together to keep everyone safe.
Instead of using restraints, our care team takes a person-centered approach, one that's built around you. That means getting to know you, earning your trust, and creating a calm, familiar space. We might try approaches like inviting a loved one to stay with you, using a calm and gentle approach, playing music you enjoy, helping keep your usual daily routine, encouraging light movement or walking when possible, making sure you are comfortable and your needs are met, reviewing your medication, and offering gentle reminders like calendars or signs to help you remember what day it is and where you are. We'll also ask you and your family what helps you feel safe and supported, because your voice matters most. Now, let's hear from Sonia, a caregiver who supported her husband through dementia.
When my husband was in the hospital, I saw how small comforts made a big difference. A blanket from home with photos of our family, familiar music playing softly in the background. These little things helped ground him and helped the staff understand who he really was beyond the illness. That's why I always tell families, share what makes your loved one feel safe and cared for. The care team also uses a tool called the All About Me form. Completing it helps explain your loved one's routine, their favorite meals, and even the fact that they like to be greeted with a smile. Steve especially liked it when people joked with him and it would get him smiling immediately. These small things helped everyone to connect with him as a person. When you leave at the end of the day, knowing that your loved one is being treated as a person and that they are comfortable, you can sleep easier at night and be recharged, ready to see them the next day.
At the Ottawa Hospital, we follow the facts and principles of patient-centered care. Your safety and dignity are our priority. There may be times when restraints are needed as a last resort when all else fails. For example, if you're at risk of pulling out breathing tubes, removing important medication tubes, or hurting yourself or others. If restraints are ever needed, we use the least limiting option for the shortest time, explain everything clearly, and regularly review your care with you and your family.
Your questions and concerns are important. If you or your loved one want to talk about restraints or any part of your care, please reach out to your healthcare team. We're here to listen and support you.
Thank you for trusting us with your care. Together, we will work to keep you safe, comfortable, and respected every step of the way.